protection, then rest, compression, and icing and elevation. So whenever there is an acute injury, there is 72 hours to 48 hours. That's the window period for the acute cases. We usually use ice pack. So when you use the ice pack, same thing. What's the limbs? Whenever there is injured, the immediate response is the inflammations. So that's your body response to the any injury or any infection and stuff. It causes inflammation. So now if we put it ice pack, we are doing the vasoconstriction. That means we are limiting the flow of the blood to that area. So when you're limiting that, so the nutrition which is required for the healing in the initial phase, so that there will be a gap because of the ice pack. So this 72 hours to 48 hours, that's the window period for the acute injury. So suppose I'll give you an egg, I crush it. So all the nutrition will go, all the life of that egg will go. Now only the eggshells, only the debris will be there. Same thing what happens now when the nutrition are coming in that area for the healing, we are stopping with the ice, giving the ice pack. You get it? With it's required is healing. All the blood flow is required for that areas. All the nutritions, the minerals, whichever it comes for the healing purpose. Because your body is very intelligent, it knows how to heal itself. We just have to now in the starting phase we just have to support that healing process. So when we are giving the ice pack, again we are delaying the healing process. So for the starting, what we will do is breathing. The starting is breathing. Let the inflammation be there, swelling be there, until it's not causing you so much pain and discomfort. Usually if there is a swelling, it will be there, the pain, because the tissue are expanding, right? So first thing what I tell all my patients is breathe. They have to breathe from the diaphragm, because whenever you activate the diaphragm, it activates your vagus nerve. So it helps you to calm down the body. So we have that fear response when there's pain and inflammation and stuff and swelling there, we have to do something. No, just let the limbs be there. You have seen our ancestor and all, like ancestors and all, they did not have ice pack when they get injury and stuff. They let it be, or they'll just use some jari and stuff, right? And they won't do anything. They'll just tie it, rest, or they'll do the limited movements, whatever it's possible. They play with the little movements. So that's why now what we are finding is like just breathe whenever there is swelling and inflammations to support the healing process. Got it? And bring it straight.
Now I should not keep ice pack.
Yes, you can put if the pain is coming down.
Like only have to put it under the knee.
Yes,
That's all.
below the knee is fine.
Then
Even
where else I can put?
here it's fine, here is fine. Or if not, then gentle with 5-6 towel roll,
Okay.
little hot pack in the surrounding areas. Just support.
Okay.
Okay. So we are doing a contrast. You can use a contrast again. Cold pack, hot pack.
Hot pack.
Yes.
After keeping the hot pack, I can keep.
Yes, cold pack. End it with the cold pack. So we are doing
Only
is
under the knee.
yes.
No.
Under the knee, even in the pada, if you want, you can use.
Here.
Yeah, all these areas you can use. No problem. No issue.
Pada. Not on this.
Yeah. And drink as much as water as possible. Okay. Drink water, listen to good music, and sleep. Main thing is rest. Sleep is very much important for your recovery. If you don't sleep, ask your doctor painkiller. I want to sleep, give me some painkillers so that the pain comes down, I can sleep. So that's the initial, like whenever you rest, your body tends to heal. We cannot keep on doing exercise and no rest in the body. So there's no space. So again, after this tissue injury, what you'll have? You will have a scar tissue formation.
Okay.
The fascia, what happens, like the gap no between after the any injury, there will be a swelling. Relax, relax, keep it straight. Yes, weight bearing exercises we have not started yet, because after fracture, it's not only the fracture of the bone, it's the soft tissue, your nerves, your blood vessels, and other tissue around the whichever area it's fracture. That's why whenever there's a swelling, you'll know or inflammation is there, we need to provide support for the body. Instead of giving ice pack, we have to do the diaphragmatic breathing, allow the blood and the nutrition to flow in this area. So we're allowing by the breath to flow in this area. So that's how your body is very intelligent to give which nutrition in this area, and stuff, how to heal. It will do it by itself. Now what we have to do is we have to be the support system for the injury which you have. Got it? So there will be pain, there will be little bit inflammations, but you just have to bear and just do the breathing exercises and all the blocking which I have to tell you. The stomach, the flexors, the thighs, the knees, the calf, all those things. Just be there for 3 minutes and breathe in and out.
Daily twice.
Daily twice. So that what we are trying to do is we are decompressing the fascia, and it will allow the blockage of whichever addition you have, the nutrition to flow in this area. So when we do is ice pack, that's a vasoconstriction. So it will restrict the blood flow in this area. So we are doing the opposite. We are creating more space, more blood circulation in this area so that there's a faster healing and recovery. Got it? The same thing. Now we're just healing. If there is no healing properly happening, so there will be adhesion formation, scar tissue formation, and there won't be a proper healing of the tissue, bones and joints. So that's why it's like a black hole. Whenever you don't give that free period of 48 to 72 hours after injury, the proper healing time for the nutrition to go there, and you put ice pack, you restrict that area, or you can say limiting the blood flow in that area. So the unwanted debris, in even in thermodynamics you have seen, like in the black hole, all the when there is an earthquake, there's a crack, all the debris goes inside. Same thing, there is no life in it. So when there is no life in it, same thing, the fascia will pull. So like you're cutting a sweater and there's a small hole, what happens, the when you try to stitch it, the sweater becomes small, right? Because of that hole.
Yes.
So same thing happens when there is no enough healing happening or no nutrition. What will happen, the fascia will hold you like this, it will shrink, it won't allow you to move properly. So that means like there will be adhesion formation. That's why the proper healing is required. So for that we have to provide proper nutrition, the blood flow in that area. That's why that window period is very much important after injury. So I hardly give ice pack during that phase. I just I ask them to breathe in. Main thing is diaphragmatic breathing. Allow the body to do itself. We just support these limbs wherever the problem is there.
I
And
think only from the third week we started ice pack.
yes,
First 2 weeks we didn't keep ice pack.
no ice packs.
No hot bag, no ice pack.
Yes, just allow and support. And main thing, drink water, take rest, sleep. And you do not get any sleep also.
Yes, 1 month at least.
So now it's fine. Now I'll ask you to bend your knees. So now we'll bend your knees. While bending the knees, you have to breathe out. When I'm taking it up, breathe out, bend, breathe out, breathe out, breathe out, breathe out. Hold it there. Now we'll do a eccentric hold for the hamstring. Now I'll ask you, I'll give you a command. When you're making it straight, you have to hold. Okay? Straight, hold, straight, hold, straight, hold, straight, hold, again, hold, again, hold, again, hold, again, hold. Very good. Now again we'll do the quad activations. So whenever you're doing a quad activations, you have to be in the long sitting position. Why in the long sitting position? Because the body weight will be dying on the pelvis, it won't allow to compensate. So it will give a proper activation of the quads. So when you're doing is how to activate the quads is, can you push me up towards the ceiling? Yes, just hold it there and just tap over the muscle here. Just ask them, Subah ho gayi mamu, jaag ja. So all the sleeping muscles, we're just asking them is get up, get up, get up. So I'll be there for 30 seconds. You can relax. Now take it up. Push the knee towards the, yes, bottle again. Yes, 2. Again 3. Man, whenever you're putting anything below the knee, it should be hard surface, so that if it's soft, it won't activate the muscle only, the knee only will go down. So it's better to have a hard surface
Only
again.
for block the soft surface.
Yes.